Good afternoon, everyone. Thank you very much for joining us on this Friday afternoon. My name is Lisa Clark, and I'm the Executive Director of the Destination Medical Center Initiative. And so very happy that you are here. Today's session is part of a series that DMC EDA has been embarking on as we walk through our 5-year plan update. And what a perfect time for a 5-year plan update for us. And we are here to share that with you as well. We feel very strong and very confident that our last 5 years have been very positive for the community of Rochester and the state of Minnesota. So our 5-year update actually includes a few things. It includes a look back at the last 5 years. So that's what we consider phase 1. It looks at setting our stage for phase 2 for 2020 to 2024 with some targets. And then the additional considerations is, of course, what we're all experiencing right now, the implications to COVID. And so today you're going to hear quite a bit of that, what the implications of this pandemic will be, or we expect will be, for the Rochester, the area, and for Minnesota. So we hope today that you will glean a couple of nuggets of information that you can take back with you, and please sit back and enjoy your lunch and write down some questions that you have for us, because we have time for that at the end of the day. It is my great pleasure now to introduce Patrick Sieb, my colleague with DMC. He's the Economic Development Director and Placemaking Director with our organization, and he's going to walk us through a bit about the 5-year impact and introduce our team and the session today.
Thank you, Lisa. As Lisa said, my name is Patrick Sieb, Destination Medical Center. Today's work is really to quickly get us to a conversation about the impact that COVID is having on our economy. Before we do that, just a little bit of background. As Lisa said, this update involves a look back. So quickly, I'll just say we are doing a look back against 5 key metrics: new jobs, new investment, tax revenue, the planning and preparation for future investment, and ultimately transforming experience. And so we have seen strong progress in job growth, more than 80% of those jobs in high-paying, well-paying jobs, new investment of nearly $1 billion, stimulated by $98 million of public investment, DMC resources. All of that adding to the tax base and tax capacity, both payroll tax and property tax. And we have set ourselves up for a strong phase 2 with respect to our planning for mobility, rapid transit, public space like Heart of the City and Discovery Walk. Again, aiming towards transforming the experience in our community. So whether you live here as a community resident, whether you're a visitor, a student, or a patient, or a companion, we really want to transform the experience in such a way that it makes it, that it's a very appealing and welcoming experience. As I mentioned, there's been more than or nearly $1 billion of capital investment development in the downtown, some of it by Mayo Clinic, some of it by non-Mayo Clinic, as you can see on this map, spread throughout the downtown DMC district. That investment was stimulated by $98 million, as I mentioned, in DMC dollars. Let me go to the next slide, Aaron. $98 million in public investment for things like streets and sewers, mobility, the planning that we've been doing in public realm, and of course, catalyzing private development itself. Next slide. Last week, we had a presentation led by Joel Minicosi of Urban 3, whereby they looked and helped us understand how important downtowns are to building a strong community. And they looked at it simply through the lens of value per acre and how much your downtown contributes to the tax base to support the rest of the community. So perhaps you don't live in downtown, perhaps you don't work in downtown, but the value and the benefit to you as a community member, wherever you live in Rochester, is that the downtown pays disproportionately more taxes and contributes to the tax capacity disproportionately when compared to the rest of the city. And it has grown and nearly doubled in the past 5 years because of the $1 billion worth of new investment. Our downtown is defined more broadly than most cities, so it includes the central business district, but also the St. Mary's area, nearby neighborhoods, and now extending out to the west at Cascade Lake as we start to build out the rapid transit system. We won't have the time in today's presentation to walk through the full body of our work on this update. We did do a very complete presentation last week, and that's posted on our website, and will be in front of City Council on Monday. But that presentation looks at where we see investment going forward as it relates to private investment, mobility, public realm, and jobs and income development. And as we looked back and as we looked forward, we asked 5 questions. What happened? What was the benefit? Is the benefit to the community? What's going well? But importantly, asking what could we do better? And that question, what can we do better? And the answer to that question is helping us shape what the next 5 years look like. So we're very proud of what's happened in the past, but we're also humble enough to know that there are lessons being learned throughout this process that we want to apply to the future. And here's why it matters. In phase 1, again, I mentioned $98 million of DMC funds expended. We expect that there will be upwards of $200 million, $200 million of state support coming into Rochester to help invest in the infrastructure in our community. And so it's critically important that we learn from the first 5 years, that we learn from the work that you're going to hear about in just a minute from our colleagues at HR&A, and that we use that to help inform decisions for that $200 million over the next 5 years. That being said, as we are doing long-range planning, we also understand there's an immediate response and a need for immediate response in front of us. And so we have been part of a collaboration of effort going on in Rochester to immediately pivot and respond to the crisis that we're facing with COVID and the pandemic and the economic disruption associated with it. On this slide, there's a few of the examples of things that we have been involved with, whether it's the infrastructure to support the outdoor patios for many of the downtown restaurants, so you can see the painted jersey barriers, programs that help support businesses who wanted to innovate and transform their own businesses, the business pivot blog series as a way to give visibility to businesses that are transforming. And of course, our partnership with Rochester Ready, which includes the city, led by the City of Rochester, Rochester Chamber of Commerce, Rochester Downtown Alliance, Experience Rochester, the Convention and Visitors team, all of us working together and Mayo Clinic to find immediate solutions to the crisis in front of us. And as we're responding to the crisis in front of us, we're also taking on the responsibility of looking down the road. So next slide. So today's presentation is part of our looking down the road. And I have on this slide a couple of other presentations that you can find on our website at dmc.mn. The presentation called Dollars and Cents of Development Patterns, and then the more in-depth presentation of our 5-year update called My Community. And then we have some other presentations coming up with the Rochester Chamber of City Council on Monday afternoon. And then we're very excited to be hosting Tom Fisher, former Dean of the College of Design at the University of Minnesota, on November 17th, as he presents a picture of what a post-pandemic city might look like. But today's presentation is about the impact that COVID will have on our economy. And to help us with that, we turn to HR&A, a real estate and economic development consulting firm that's worked all over the country, a firm that's worked here in Rochester and southeastern Minnesota, but also in other parts of Minnesota, the Twin Cities, but certainly all across the country. And their work has been extraordinarily helpful in the past, and I think you will agree that it's going to be extraordinarily helpful as we move forward. We asked them, in our next slide, we asked them to help us understand the near and long-term impact that COVID will have on planning and investment decisions, and to help us think through dynamic scenarios around the impact it'll have, best case and worst case and conservative case, optimistic cases. I mean, really trying to understand the various ways in which COVID could affect our economy. And with that, I'd like to introduce our 2 presenters from HR&A, Shupratim Balmek, who is a partner with HR&A Advisors and more than 2 decades of experience, and Aaron Lonoff, a principal who has a decade of experience working in urban planning, economic analysis, and real estate development. She's based in Minneapolis, Shupratine in New York City, and we are very excited to have them as a part of this work today and their presentation. To help engage you and to engage you all in this process, I encourage you to use the Q&A function to ask any questions that you might have. If you need clarification or interested in more information, pop that into the Q&A box and we'll field that towards the end of this presentation. So with that, I'll turn this over to Shupratine.
Great. Thank you very much, Patrick, and good afternoon, everyone. Again, as Patrick said, my name is Shupratine Dhamik. I'm the partner at HR&A. So our presentation today, this afternoon, is going to cover a few topics. We'll start with the COVID-19 context, talk about global epidemic precedents, the recovery framework that we have used to approach this, talk a little bit about the recovery framework and how it applies to Rochester and the Rochester context. And finally, get to sort of our key findings in terms of both economic impacts and what it means for the DMC going forward, and what we see as some lessons learned, both in terms of the things that the DMC and the city and your chambers of commerce are doing, but also some of the lessons learned from other cities and other parts of the country. So, in terms of the COVID-19 context, this is a dual health crisis and economic crisis. As you can see, we now have, and these numbers are slightly outdated now, we now have close to 8 million people in the US who have been infected by COVID. Worldwide, I believe the numbers are 30 million plus. So it is, in the true sense of the term, a global pandemic. And in addition to the health issues, it has some tremendous impacts on our economy and other parts of the society. We have recorded the steepest job loss in the U.S. as a result of the pandemic, over 20 million job loss in a month, and we're slowly recovering some of those jobs back. But in all sort of respects, as you think about this, we believe the recovery is going to be slow and arduous as we sort of figure out some of our healthcare solutions and some of our public health milestones with this. And this is just still a very, very narrow picture because it just talks about losses in jobs. Obviously, some of the other challenges that you all are facing, including sort of schools and remote learning and business closure and losses, are also a big part of sort of the impacts of COVID-19 that we're all facing and we'll continue to face going forward. In terms of thinking about just sort of the economic sort of parts of this, some of the sectors that have been impacted, and this is national data, are some of the key sectors that Rochester really depends on. Hospitality and tourism. The city attracts 3 million visitors every year. Both for the patients and their companions, as well as all the convention goers and meeting goers. Education and health, and sort of Aaron is going to talk about the importance of Mayo to sort of the Rochester economy, and certainly retail, which is a key part of sort of downtown and the city as a whole. So these three key sectors have been impacted nationally, and we'll see sort of their impacts on the Rochester economy as well. We know retail was being challenged, sort of street retail and Main Street retail was being challenged even before COVID. This is a graph which shows how online retail sales has been growing over the last 10 years, both in terms of dollar value as well as a share of percentage retail. And what has happened post-COVID is that this has had a significant impact on sort of retail sales throughout the retail sector. Again, national data, this shows you that apart from grocery stores, almost every kind of retail that we can think of has been severely impacted. Now, part of this was obviously dealing with some of the permanent closures that were made in the initial few months, but still, there's significant impact on the retail sector as a whole, which we'll sort of talk about in more detail later in the presentation. And finally, what this has led, as you all know, is a decrease in aircraft travel and visitation, including international visitation to the U.S. Some of the high-level statistics over here: a 31% decrease in visitor spending in the U.S. Hotel occupancies are significantly lower than what they were at the same time last year. And if you look at sort of global travel in terms of frequency of global airlines, it's a significant dip from where we were pre-COVID. So all of this is to sort of kind of set the stage for what we are facing right now. But sort of looking forward, as Patrick said, what does this all mean? What do we think are going to be the sort of likely recovery scenarios for the nation as a whole, as well as for Rochester going forward? And to do that, what we did was look at some global epidemic precedents. Going back for the last couple of decades, we looked at and we analyzed sort of the timeline for SARS, the Middle East MERS, and H1N1 to try to understand how recovery depended on sort of key public health outcomes. So in this graph, in this slide over here, we're just showing one of those examples, SARS, and you can see from the time it was first sort of detected in southern China in fall 2002, then spreading across parts of Eastern Asia to Hong Kong and other places, to December 2003, so a year plus was the timeline it took for essentially from the detection of SARS to a point in time when sort of consumer confidence rebounded and sort of economic activity rebounded. So we did the same exact analysis for some of these other sort of global, these other sort of epidemics as well, to understand, you know, how the COVID crisis would potentially impact sort of our economic recovery and its direction. As you all probably know, and as we are hearing sort of in the news almost every day, there is a lot of activity, a lot of research going on, both in our institutions as well as in the pharmaceutical companies. But the timeline for vaccines right now is unclear. I think the information sort of that we have is that most people estimate that December 2020 is going to be the earliest a vaccine is going to be released. Obviously, post its release, it's going to take some time in terms of its deployment, in terms of distribution, and the more conservative estimates point to something closer to December 2021 for distribution and deployment. So we have a wide time period for at least a year between December 2020 and December 2021, in which we believe, you know, vaccines and potentially other sort of therapies as well could be introduced into the market and could be widely available for people to sort of achieve that sort of public health milestone and start starting to sort of boost up sort of consumer confidence in terms of in travel and spending and other kinds of economic activity. So with that said, I'm going to hand this over to my colleague Erin Lonoff, who will sort of talk about, actually I have a couple of other slides that I want to do before I hand it over to Erin. So let's go to the next one. So as we sort of think about sort of the recovery framework over here, we've sort of broken it down into three different pieces. The first piece is really sort of the economic shock, which is how deep was the nadir of this recession, and by most accounts, most economists believe that it was sometime in sort of June or July that we hit sort of rock bottom. Coming out of that economic shock, what do we think is the rate of recovery? How quickly will businesses reopen? How quickly will they start rehiring, for example? So that determines the rate of recovery. And finally, as we come out of this recovery, what does the new normal look like? Now, we all know that sort of what this COVID crisis has done has accelerated a lot of changes that we saw already happening pre-COVID. You know, we talked about things like online retail sales, which were increasing. We had sort of phenomenon like working from home, which we think is going to get much more credibility as part of the new normal. So the idea over here is to break sort of our recovery framework into these three different pieces and think about, from a scenario perspective, how these three pieces fit together in the Rochester context. And a big takeaway for us is here, for none of these recovery and new normal frameworks are deterministic. There's a lot we can do from a planning and an intervention perspective that can change and bend these curves. Obviously, as I said, there are macro factors like in public health milestones, which are going to be very important. But at the local level, at the city level, at the municipality level, there are a number of different things that we believe that cities and communities can do to change and bend the curve, bend the recovery curve. So putting this all together, what does this economic framework look like in the context of COVID over here? Clearly, starting with the peak, at least one of the peaks that we hit in March of 2020 when the infection first came on, we had a number of stay-at-home orders and business closures, which led to the sheer drop in economic activity. Again, as I said, most economists believe we hit the trough somewhere around June or July. And since then, we have seen sort of growth coming back. But that growth coming back is going to be, again, different across different sectors of the economy. It's going to be different across how strong some of these individual cities and local economies were, sort of to start with pre-COVID. And then looking forward after the recovery period is really about what this new normal looks like in the context of our post-COVID world. So I'm going to hand this over to my colleague, Erin Lonoff, who's going to talk a little bit about how all this recovery framework can be applied in the Rochester context to understand the impacts of COVID on the Rochester economy.
Great. Thanks,
Erin?
Trooper Team. Hi, everyone. I'm Erin Lonoff. I'm a principal with HR&A Advisors. So let's dive right into the Rochester context. Health services, the leading employment sector, and hospitality have been hit hardest in Rochester. Unemployment rose to 5.9% from 3% in 2019. And compared to the state's unemployment rate of 7.9% in July 2020, Rochester has been faring a little bit better than the rest of the state of Minnesota. As you all know, the Mayo Clinic is central to Rochester's economy and a driver of downtown vitality. Mayo's role in Rochester's economy is not just its direct employment, which is significant. It also spurs other jobs and spending in the economy. So, for example, companies in medical and research fields, industries locate in Rochester to be adjacent and to partner with the Mayo Clinic. As Trooper Team mentioned, 2 million visitors come to Rochester each year because of the Mayo Clinic. And these visitors and companies all spend money in the economy. So it's both direct employment from Mayo as well as all of these sort of spin-off activities that are one of the big drivers of Rochester's economy. I'm going to dive now into, I think, why everyone is logged on to this webinar today, the impact analysis and our findings. So to start with, I want to frame sort of our scenarios or these alternatives that we've modeled. Economic recovery is going to be linked to consumer confidence. As Trooper Team talked about, consumer confidence is not going to bounce back until there's a therapeutic or vaccine. And one of the keys of this analysis is the high degree of uncertainty related to COVID. We developed 3 scenarios based on the recoveries from previous epidemics and the potential timeline for current medical advancements that are going on right now for COVID. The idea is to provide Rochester with the best available information so it can make informed economic development decisions for its future. As we said earlier, some believe the vaccine may be released as early as December 2020. Others estimate that it may be the end of 2021. So our scenarios sort of assume an optimistic, moderate, and conservative approach for this range. Our most optimistic scenario estimates a vaccine or therapeutic is released in January of 21, And then following this following this sort of the international epidemic precedents that we looked at, we assume that consumer confidence is going to return a few months after that. And that's sort of that time period when that new normal can begin for the Rochester economy. Our moderate scenario assumes a vaccine or therapeutic is released in June of 21, and consumer confidence resumes a few months after that. And then finally, our most conservative scenario assumes that a vaccine or therapeutic is released at the end of 21, with consumer confidence following that. And then each of these scenarios enter into this phase that we call this new normal. And as Shruti mentioned, life after COVID is likely going to look a little different than what it did pre-COVID. For example, we're anticipating that many people are going to be working from home permanently, particularly if they have office jobs that allow for that. So our model also takes into account sort of varying degrees of assumptions around remote work and the return of the hospitality industry, with the most optimistic scenario assuming a return that's most similar to December of 2019, and the most conservative scenario assuming that there is more remote work as well as fewer large conferences and large events taking place in Rochester in the long run. Our model then takes these three scenarios, job and economic spending inputs, and creates outputs in the Rochester economy in terms of direct, indirect, and induced impacts, and the change of economic activity. We then are going to translate those into metrics that are sort of make sense, but let me first start with the economic model. So first, with the model inputs, the primary drivers of Rochester's economy are visitors and employment. So to begin with, on the left-hand side of this slide, we look at sort of three big drivers. One is the Mayo Clinic, and is a significant driver of both direct employment as well as non-employment spending. And this translates into spending by Mayo Clinic employees in the economy, as well as those businesses that are being hired to provide non-employment that have contracts essentially with Mayo and their spending, those employees' spending in the economy. There are other industries in Rochester as well that employ many, many people. Finance, real estate, education, they're huge drivers in the Rochester economy. And they provide a stable employment base that enable residents and workers to spend disposable income in Rochester. And then finally, the other big input is the 3 million convention goers and patient visitors and patient companions to Rochester each year. They spend money primarily through overnight stays at hotels and restaurants. And all of these inputs then come together and support retail, food and beverage, hospitality industries directly, while also having indirect and induced impacts on the Rochester economy. So we're now going to jump into the model outputs effectively. So using the inputs that I've talked about in terms of the timing of the return of consumer confidence, as well as the jobs and spending in the Rochester economy sort of pre-COVID, our model then projects a gradual recovery of the Rochester economy following significant loss from December 2019 to June 2020. From December 2019 to June 20, Rochester saw a decline of nearly 20% of its economic activity. For comparison, the US GDP declined by 30% from Q4 2019 to Q2 2020. Economic activity, in this sense, is generated by businesses, residents, and visitors in Rochester. The chart on the right reflects the changes in direct employment and visitor spending, indirect impacts of the loss in business-to-business purchases, and induced impacts, which include the loss in spending of labor income. And these spending changes and this economic activity also includes the reduction in the Rochester economy as a result of furloughs and permanent work from home. We've estimated that by the end of December 22, Rochester's economy is going to have significantly recovered, but will still be about 2 to 7% lower than pre-COVID levels. So what does this mean then for the DMC?
Aaron, I'm just going to have you go back because I want folks to picture this slide as we get into the latter part of the discussion, where we talk about how we can bend the curve and perhaps accelerate our recovery here in Rochester. So maybe just so for those of you who are watching, just sort of fix this image in your mind as a starting point for the work that we want to be doing here in Rochester to bend this curve. And then I will just say also to remind you, the Q&A box is open, so ask questions. There have been some that have come in, and we'll field those later in the presentation. So go ahead, Erin. Sorry.
Great. Thank you, Patrick. So our model takes these three scenarios and has translated into economic outputs. But now it's important to sort of translate that activity into metrics that matter for the DMC and for economic development planning. So what we've done is now taken these economic outputs and we've looked at these in terms of job loss. What this is showing is citywide employment is not going to fully recover to pre-COVID levels by the end of 2022. And the hospitality and retail sectors are expected to recover much slower than office using jobs. So this slide is showing us the estimated job loss by scenario, scenario A being the most optimistic, scenario C the most conservative, by real estate asset classes. So in the office industry, we're projecting that in December 22, permanent job losses, and job losses, I'll remind you, include furloughs and permanent work from home. So these are the jobs that are no longer physically in Rochester spending money, will be reduced by 400 to 1,300 jobs. In the retail sector, we're projecting upwards of 1,100 to 2,400 jobs that are lost in the economy. And in the hotel industry, a little over 100 to 278 jobs that will be fewer in December 22. We then take those job losses and job changes and translate them into real estate asset classes. So it's important to sort of understand the impacts to downtown as well. And we need to approximate the job loss that has been seen citywide into downtown to understand how this affects DMC planning. So what we've done is, based on approximate averages of built space across the city, we've assumed corresponding percentages of jobs will be located downtown. So for example, 44% of office space in the city of Rochester is located downtown. And correspondingly, 44% of that job loss we assume will take place in downtown Rochester. So finally, we applied our findings to help the DMC think about the potential for phase 2 development. There are already a number of developments that are under construction or recently completed in the DMC district as part of phase 2. And the DMC and the city should support these projects to ensure that they continue to be successful. Given the reduced economic activity in downtown that we're projecting through December of 22, we don't anticipate the need for further construction of hotel, office, and non-Mayo research space. But however, we are projecting the potential for more housing development in downtown Rochester. So next, the city really should be thinking, and the DMC should be thinking about how to use phase 2 to grow their economy, and what is next. So I'm going to turn it back to Sherpa team to talk through some of those next steps.
Great. Thank you very much, Erin. And so I know that was sort of a lot of information coming at you at a very, very quick pace. And I wanted to summarize some of the key points over here. And before we open up to sort of Q&A and hopefully a very robust discussion. So clearly, I think one of the first takeaways over here is there is a lot of uncertainty around the full impact of COVID. We don't know when a vaccine or a therapy is going to be made available. We don't know when it's going to be deployed. And that is a critical milestone in sort of understanding when we think consumer confidence is going to come back, when economic activity is going to come back. Second, Aaron, will you go to the next bullet? Pre-COVID, Rochester was a growing economy. You had very, very strong fundamentals, and your development, as Patrick was describing, was largely aligned with sort of the market demand, whether it was office or retail or research space or hotel hotel rooms that were coming online. So you were starting off in a pre-COVID basis, in a very, very good place. What we have right now, looking forward to the next 2.5 years, we believe from our analysis is that Rochester is going to have excess capacity in the downtown office market due to sort of job losses in the office sector. And as Aaron was talking about, growth in remote work becoming much more sort of a normal going forward. Downtown retail and restaurants, which we know are dependent on employees and visitors and patients and their families, would be disproportionately affected in Rochester. And hotels, which have experienced a precipitous drop in occupancy rates, will continue to remain impacted. As Aaron showed, we have some hotel rooms coming in the pipeline, and we think the market will continue to see occupancy rates below historic averages going forward. The one really positive and optimistic sort of data point over here is housing demand. We know that the city, as well as the larger region, has a significant inbuilt demand for housing demand and also for downtown living. So we think housing demand will be relatively strong. And we also think growth in downtown residential will help support some of the core retail businesses that are there and that are planned for the future. So that is those are sort of our summary and key takeaways from the analysis and research.
Yeah, let's just go back to that slide, Aaron. So again, this is your high-level takeaways, as I understand it, that if you reduce the data and the graphs into talking points, this is what and it probably doesn't shock anybody who's watching or listening or paying attention. This is probably not a surprise. I think it's super helpful to have it measured in the way that you've measured it. We do have some questions in the Q&A box that I want to get to, but I also want to, if we think about this in a way as a diagnosis, like this is, we sent the patient in for an MRI, and this is the diagnosis, and these are the findings. I like to think about the question is, then what do we do about it? And that's sort of what your next slide is about. So I wanted to sort of tee up this transition.
That's excellent. That's excellent. This is exactly right. That was the diagnosis and sort of, the prognosis going forward. So thinking about if that previous slide was the diagnosis, sort of, where do we go from here? What are some of the creative ideas? What are the things that that DMC and the city and the chamber and you all are doing, the community is doing? And what are some of the creative ideas that we are seeing in other parts, in other cities, in other parts of the country? I think one of the first things we need to start off with, and it's almost sort of, commend all of you on this, is even though the pandemic has hit pretty much everywhere in the country, not all sort of cities, not all municipalities and jurisdictions are responding to this. So I want to commend you for the fact that you all are thinking sort of very thoughtfully and creatively about taking this diagnosis, as Patrick so happily put, and thinking about what those recovery strategies might look like, which is all about sort of how do we bend this curve. None of those scenarios that we've sort of described are a given. I think there is a significant ways and methods in which the community and your economic development staff and private investors can come and bend that curve. As Aaron just said, Rochester has fared better than other cities. Even though our unemployment rate has gone up, it's significantly lower than the state as a whole. And that again speaks to the strong fundamentals that the city had coming into this crisis. So we start recovery from from a position of strength over here. We had a growing and a robust recovery economy, which was foundationally based on the healthcare industry and Mayo Clinic and our tourism and hospitality industry. So thinking sort of more creatively about sort of what can the DMC be doing to support more growth. And we wanted to sort of jot down a few ideas over here and open up the discussion and the Q&A section. Some of these things, as Patrick mentioned, in terms of supporting existing businesses, local businesses, whether it's opening up sort of al fresco dining or helping them with federal programs is already being done. But there are other things that we are seeing in other places and other cities that we're working with on their post-COVID recovery strategy, thinking about public infrastructure and how that can be used as a attractor, as a compelling argument for people, for downtowns to sort of get revitalized and thrive again. We spent a lot of time thinking about using excess real estate capacity creatively. As we just described, for example, we think the hotel industry is going to be suffering from pretty low, significantly low occupancy rates going forward. So what are some of those creative uses for potentially some of the hotel rooms that are going to be empty and available? What are some of the things that we also be thinking about? And we can talk about some examples of other places where some of those rooms are getting repositioned, some of those properties are getting temporarily repositioned to essentially help, again, thinking about recovery strategies.
Why don't we just talk about it? I mean, I know, Aaron, you had shared some ideas, things that you know of that are happening elsewhere, and it might be useful just to give some examples. And Lisa has rejoined this conversation as well, Lisa. So feel free to take yourself off mic, or rather unmute yourself, so that as we try to engage and moderate this conversation, feel free to be a part of that. Aaron?
Yeah, so one example that we've talked about and what we've seen sort of nationally is during the Great Recession, for example, Philadelphia had a number of office buildings, Class B and C office buildings that were vacant, not doing well, particularly in the economic downturn. And as the economy started to regrow, these spaces still were not being refilled, but there was demand for residential in Center City, Philadelphia. So some of these older office spaces that weren't meeting the needs of new and growing companies, the few that were sort of growing in Philadelphia at the time, were replaced and renovated to become residential buildings, and met that growing downtown residential demand. So that's sort of one concept or idea that depending on what your office space needs are, might be applied here in Rochester.
Yeah, I mean, I think that was an example that I recall you talking about. And as you think about how that was done, I mean, what were the strategies? How did people get motivated around that? I mean, how long did it take before people realized, hey, Class C office users aren't coming back into downtown Philadelphia?
Yeah, I mean, I think it was a sort of a combination of a few things. So one, it was weak asset classes. So the sort of office owner that really just hadn't been doing well with its very, very dilapidated office building, sort of combined with the need from multifamily developers who wanted high-rise construction where those costs were very, very, very high in Center City, Philadelphia, relative to the rents that you might achieve. It was really, frankly, a cost equation, that it was cheaper and easier to renovate an existing high-rise office building than it was to try to build ground-up construction on a piece of land that probably didn't even exist in the location that they wanted. So I think in terms of the sort of Philadelphia story, there are a few examples of this, and the timing, I can't speak to right on the fly right now, but it really is sort of comes down to an economics question.
Right.
And Patrick, if I might.
Sorry.
Go
One
ahead,
thing we have
Lisa.
going in Rochester, I think it's very positive, is our size. So we're not too big, and we're not too small. And we actually have a great example of collaboration, or many examples of collaboration, where we could actually tackle something like this if we really want to leapfrog to the future and make sure that we are sort of ahead of the game in terms of this pandemic. We can bring people around the table and do just that, and have discussions like you were just sharing, examples that you were sharing, Erin, and move our community forward. So I think it's another value of the size of Rochester right now seems to be a good fit for sort of turning the corner or bending the curve, as Patrick was talking about.
I was going to add, Patrick, if I may, sort of, another example with a different asset class, hotels, for example, and sort of kind of what we foresee as sort of low occupancy rates is how do we creatively use some of that space. Thinking about, examples in other places, long-term residencies, affordable housing, thinking about some of the meeting space and other kinds of public spaces they have, which potentially could be repositioned on a short-term basis for other kinds of sort of community uses, whether it's sort of, small creative, schooling pods or things of that sort. So there's a lot of interesting sort of ideas, I think, that we are seeing bubbling up, which we think could be really, really useful to think through whether and how they could apply to this context in Rochester.
Yeah, thank you. Erin, I'm going to ask you to comment on this notion of public infrastructure investment during a downturn and sort of the experience that we saw nationally in the 2009 downturn. And I'll let you answer that in just a moment, but Shubertine, one of the questions that came in that I want you thinking about and answering after Erin has the floor here is the consumer confidence piece, that you all make the argument that consumer confidence will be the driver, and sort of a question about what is the lag time, what is the lag time before consumer confidence comes back post-vaccine or post-therapeutics. So give some thought to that, but Erin?
Yeah, sure. What we've been seeing across the country during the last recession, but also in the last 25 years, is a significant investment in public infrastructure in downtowns. And what we mean by that is public spaces, sidewalks, parks, transit, all these different things that make cities and downtowns livable and enjoyable for both those who work downtown and those who live downtown. And one of the strategies that a lot of cities took during the economic recession, or the Great Recession last time, is because of the decline in the need for commercial space because of the economic decline, there was still interest and demand for residential housing in these downtowns. And so this focus on public infrastructure investment really was about making these downtowns livable and attractive to residents, and eventually, frankly, talent. So the sort of first curve that we see in downtowns after the Great Recession was an increase in downtown living and new residents because they wanted to be there because of the parks and transit investments. And then the second wave, as the economy recovered, new companies wanted to be located in downtowns. This is why you see large companies announcing their moves to downtowns these days.
Mm-hmm. Thank you. Shubertine, on the vaccine and the consumer confidence assumptions?
Yeah, so I think sort of, let me start with sort of the vaccine and the public health milestones first, because I think that's sort of the starting point of this discussion. I think it's really, I think most people realize this, but it's worth emphasizing that having sort of a vaccine that is, manufactured in sufficient quantities, that is distributed across all channels, and that is deployed and people do get vaccinated, I think is going to be a really, really important piece. It's right now not clear if this is going to be, one vaccine and you're done, or you would need a second vaccine or multiple vaccines. So there is some sort of, uncertainty about exactly sort of what the efficacy of the vaccine is going to be. But sort of leaving that aside, if we assume that there is some sort of a public health milestone, whether it's a vaccine that is efficacious, which is met, you know, our experience going back to looking at some of these other global epidemics is it takes between sort of approximately about 2 to 3 quarters for consumer confidence to come back. I think people need to sort of understand that sort of, you know, after a new vaccine is they have taken the new vaccine, you know, they feel healthy, their families are healthy, and their communities are healthy before they start sort of, you know, traveling for business purposes, traveling for recreational purposes, before businesses, resume sort of, new sort of activity, whatever form that might take. So our sort of, going in thinking, and that's how we have sort of structured some of these scenarios, is that sort of from the point where an efficacious vaccine is widely deployed in our communities, it's going to take about a couple of quarters for the confidence to start sort of, rising.
Thank you. Thank you. I think that's helpful. Aaron, you were involved in the intro slide. We showed some of your work that you've done in this region. There's really two pieces I'm going to ask you about because of the work you have done previously in this region. So one is the work that you did for Mortenson as they were evaluating the Discovery Square initiative before they committed to investing here with that strategy. And so that really goes to this point that Shrupatina has made around diversifying the economy and how that's an important strategy that we ought to be pursuing. And then the second part of it comes from a question that we received in the Q&A, which is about the regional impact that work from home might have, that the downturn in the economy may have, given that so many Rochester employees live in a larger region. And of course, you did the work for Southeast Minnesota in evaluating the economic strategy for the region, I think a couple of years ago. So could I get you to comment on say more about this diversification of the economy as an important strategy, and then a bit about how this downturn may affect the region?
Yeah, sure. And I don't mean to continue to dwell on the Great Recession, but I think there are a lot of lessons learned from that experience that we can apply here. So one of the big lessons learned from the Great Recession is that the cities that fared relatively better than others were those with diversified economies, and also, frankly, those with institutions that anchored them. So places like Rochester with large healthcare institutions, which are, and colleges, also universities. Those are, first off, I guess to start, major institutions are a really important, play a really important role during economic downturns because they're not as susceptible to huge economic swings. But what we also have seen from the Great Recession is that diversifying the economy also helps to sort of mitigate those economic swings, that having lots of different kinds of industries that that are all sort of playing together in one city allow for, if one is really hurting, like the hospitality industry, there are other sort of job opportunities out there. And I think this is something that Shrupatina and I, with our Southeast Minnesota regional economic study, that was a big finding that there's really an opportunity to grow sort of the diversity of the kinds of jobs in southern Minnesota as a way to grow the broader regional economy. And then one other thing that I'd like to sort of touch on is the regional impact of work from home. I think one of the things that still hasn't really been fully seen yet is, as you can see, we're all doing this webinar from home right now. But one of the things that hasn't really been seen is city relocations, the ability for some workers to work from anywhere, and what that is going to mean for cities in the future. I'm an example of this. I was in New York for the last many years up until COVID, and COVID hit, and my family and we decided to relocate back to Minnesota because of this pandemic. And I think there are countless examples of people like myself who are choosing new cities to live in because they have this opportunity to work from anywhere. And I wonder if Rochester is going to be a place like that. Going back to your question, Patrick, about public infrastructure investment, as you all are thinking about making downtown Rochester a really great livable place, is this an opportunity for you all to attract new talent?
I think that's the kind of silver lining that that we want to talk more about. We're going to be running out of time here in a moment. Lisa, one of the notions they put forward in this slide is around being more proactive around development and kind of using our tools and resources and for that matter other tools and resources to be more proactive. Any comments or thoughts about that?
Well, I think it's spot on. For us, Discovery Square 1 and 2 are perfect examples of being proactive. And to your point about diversification, Aaron, the life science, bioscience, technology opportunities that we have, and we'll be breaking ground again on Discovery Square 2 in a couple of weeks. I mean, what a great opportunity for us to bring new jobs and new businesses that have not seen Rochester before to our community. So that's one example, but a couple of other things, we're still moving forward on transportation. Now is a perfect time to work on infrastructure such as public realm, and we've got a couple of public realm projects. So I believe it's really important for us to stay proactive in the development space. And one other comment on your point, Aaron, about being a community perhaps that people are interested in coming to rather than fleeing from. I believe that. I heard a study the other day where people are really trying to relocate to cities of our size if, in fact, they have that vibrancy. It's small enough, again, back to the size of our community, where it feels like it's got a good community vibe, and at the same time, it's got enough energy and vibrancy behind it where you can grow a family and live, work, and play, no matter what age. So again, those are some silver linings to this, which we are trying to aim for as we get through the pandemic together.
Well, let me just say we're coming up to 1 o'clock. I want to just thank both of you, Shrupatine, Aaron, for the leadership in this work, this presentation. We didn't get to all of the questions, and what's really exciting about many of the questions that we have, and we fielded some of them, but not all of them, is that I'm going to put these into Tom Fisher's court, because a lot of these, and as I mentioned earlier in this presentation, we have Tom Fisher who will be presenting on November 17th, similar format. But I'm going to put all of these questions into his court, because these are many of the questions are what does our city look like in the future? And I think you guys have stimulated that conversation. You've suggested that while we are faced with challenges, so is every other city, but we go into it more prepared, better equipped, healthier, if you will, and that if we rally together as a community and develop strategies like this, we can bend the curve and we can come out of this more aggressively and more successfully than any other community. So I think it's really inspiring and great advice, and I really appreciate this effort, and I appreciate the audience for staying with us, participating, asking questions, and I encourage you all to attend our November 17th presentation, where we'll have more conversation about what Rochester could look like in the future. Thank you all very much.
Thank you.